Hello students, this is Dr. Praveen Tripathi and with me is the legend himself, Dr. Gobind Rai Garg sir.
Namaskar.
So students, as you know that NBEMS has yet not announced the date of NEET PG examination. So Goga sir, we do not know the name or date of examination, but a reasonable guess is that at least in June it is not happening because they released the schedule till June. So most likely it is happening in July or maybe later. But I think we can safely say that we have at least 5 months left.
Definitely.
And even sir, INICT exam is in mid-May, so still enough time left for it. So sir, even if somebody who's an intern or a post-intern wants to start now, I think there is enough time left.
Yes. 5 months are good enough time.
Right. So this video is basically a strategy for those students who are either starting now or who started earlier, but because of some reason their preparation went off the rail and they want to restart in a proper manner. So this is a detailed strategy, and in the slides I will show what exactly needs to be done. So as Goga sir said, 5 to 6 months is a hell lot of a time. For entrance examination, we usually say 6 months to 9 months is the optimal period of time. Reason being, Goga sir, many students who start preparing early, they tend to burn out in the middle.
Yes.
So, starting late but accelerating at the right time and, ending the preparation at the peak, that is one of the best strategies always.
Definitely.
All right. So, what has happened in 2025 does not matter, right? What we need here is consistency and discipline. Goga sir, this is something that you always talk about. So, can you talk to the students about it?
So basically, I want to say that whatever has happened in 2025, that matters. That it doesn't mean it doesn't matter totally if you learn from that. So if you have wasted a lot of time or you have not got a good score in 25, still do not lose heart. If you consistently work hard with discipline, definitely you can get a great rank in 26. Remember, the great rank is got by those students who consistently work, not always about toppers. I have seen many students who are topper during their prof exams, but they do not get very good exam, a good result in the PG exams. Similarly, I've seen many students who are mediocre during the professional years, but they got very good rank, maybe single digit rank during the actual PG exams. So it does not matter that if you have not studied too much during the professional years, if you work hard now consistently, then definitely you can get a good rank.
Perfectly said, sir. And nowadays, what we are seeing is that if your preparation is following a schedule, it is following a structure, the results are much better than you doing something today, doing something tomorrow. So when we start preparation there and then, we should have a structure in mind that this is when I will complete my first read, this is when I start my first revision, this is when I start my second revision. So schedule is very important. Because sir, I believe our mission programs have been very successful because of this reason also.
Yes, this is one of the major reason because before the mission programs around 2.5 years back, but I had noted that students had so many resources. They have so many things even now, but they do not know how to use them.
Right.
So they will they get overwhelmed because of so many resources, so many I say information, so much.
Right.
So how to utilize? Then most of the time they are not able to revise.
Right.
So whatever is not revised, that usually is not of much use.
Yeah.
So the schedule which we are providing in the mission, that is one of the major reasons, I will definitely say, for the success of many students.
Right. This is very important. Setbacks are a part and parcel of game. There is not a single student who never has any backlogs, right? See, if you could not study for one day, if you could not study for 2 days, that is okay. It will happen every now and then. What students do is, if they go into a rough patch, just stop studying at all. They completely stop studying, and then after 1 month, 2 months, they are reminded that they have to do something. तब तक time निकल चुका होता है. So 1 day, 2 day, 1 day you woke up late, that is okay. Remember, setbacks are a part and parcel of it. This is something, Hoga sir, we teach patients who are dependent on substance. Like say somebody is dependent on alcohol. He drinks 6 days a week. Now we gave medications, he became better. And after say 2 months, he had 1 drink. Now many people, what they do is they feel so guilty that they go back to their original pattern of drinking. So we tell them that this is a slip. Don't allow this slip to become a relapse. So if you had 1 drink, try to understand what went wrong and stop it. It does not mean that you start feeling guilty and you go into relapse. The same thing I tell students, that if you could not study for 1 day, does not mean that you stop studying कि अब तो सब खराब कर दिया, मैंने अपने को गाली देनी शुरू कर दी. Setbacks happen, let us correct them.
So this is just yesterday.
Yes,
One
sir.
of the students called me that sir मन में इतना doubt आ रहा है, इतनी पढ़ाई नहीं हो रही. मतलब I am feeling कि I will not be able to clear the exam. I told him exactly the same thing that everyone feels this during the preparation. Even toppers feel that. So do not extend this period. It should not be for 5 days, 7 days. You are feeling today, it's okay. You can take a break and start tomorrow.
All right. So what needs to be done is this. Conceptual framework is very important. Goga sir, in the last 2-3 years, we have seen that vertical depth is being tested. The questions remain the same, the topics remain the same, but they are not giving the exact question, they are asking deeper aspects. So students who are ignoring concepts, who are thinking that they can just ratify everything, they are getting bad results. So students, conceptual framework, basic concepts, basic understanding, you cannot give a miss. Facts, of course, are important. 30-40% of questions would always be factual, so we have to find a way to remember them. Because sir, PYQs. What about PYQs, sir?
So this is since 20 years I am teaching. PYQs were important at that time. They are important now, and they will remain important even 20 years later.
Right.
The reason is that whenever there is an entrance exam, the examiner should have some framework on which he can ask the questions.
Correct.
And what they see the previous year pattern. So most of the topics, you can see around 95% of the topics are usually within last 10 years. Usually 4 to 5% things are new. Definitely examiner try to give something new. But 90 to 95% topics are almost same. And even if you see the exam which has been asked around 15 years ago, even this exam may have around 70% similarity to that.
Correct.
Among the topics.
Because sir, you started talking about PYTs 3-4 years back. Sir, what made you transition from discussing PYQs to now discussing PYTs?
So that is what we were discussing about vertical depth. The topics remain same. Like still they are asking the questions on tuberculosis. Tuberculosis is the most important disease in India. Regarding pharmacology, they still are asking questions in tuberculosis. Initially they were asking what are the first line drugs, what are the second line drugs. Then they started asking the side effect of first line drugs, side effect of second line drugs. Then they started asking about treatment. Then in the treatment, which mutation lead to which resistance. So the same topic they are asking deeper. But going deeper. So that's why instead of just reading a PYQ, you need to finalize that these are the topics on which questions are being asked, and you should know almost everything about those topics.
And that is why, Goga sir, if we create, say, last 10-year questions and create 50 pages and ask a student to ratify it, after giving the exam, the student has a feeling that everything came from those 50 pages, but they are not able to answer. Because you would be able to identify the words, but the concept behind it, the deeper information behind it, that is what is being asked nowadays. So that is why, again, going back to the first point, MCQ practice, Goga sir always says that you can read as much as you want. Finally, on the day of the examination, you have to solve MCQs. And solving MCQs needs information, but also the approach to solving MCQ. How to, ensure that these two options are definitely incorrect. How to rule out option. It's an art. The more MCQ you practice, the more you are able to answer them correctly. GTs, one of my favorite line of Goga sir is, if you want to make a mistake, make it in the GT so that you don't repeat that mistake in the actual exam. GTs is something that students remain afraid of. They keep on thinking that let me study and then I will start practicing GT, because if I get a bad score, I'll be disappointed. GTs are not only an assessment tool, they are a study tool. We put GT questions because we know that they're important. So if you are not attempting GT, you are letting go of the questions which have a very high likelihood of being asked in the exam and make mistakes in the GT. There's a reason why Goga sir keeps on repeating that line. Make mistake now, you will not make the mistake in the exams. Goga sir, you were talking about this, revisions. How important are revisions, sir?
They are the most important thing. I commonly used to say in my lectures also that if someone says you कि मैंने एक बार पढ़ा और मेरे याद हो गया, वो बेवकूफ बना रहा है, 4 बार कमरे में पढ़ के आया है.
Correct.
So if you are not studying 3-4 times, you will not be able to remember things. Maybe hardly 1% things you may remember, but most of the things you will not be able to recall during exam if you have not revised. So that's why revisions are the most important.
On the same lines, students, sometimes you may get very confused while watching the interviews of especially toppers who are getting rank 20, 30, 5, 10. They say कि कुछ नहीं किया हमने, तो internship चल रही थी, I just read some notes. ऐसे नहीं होता internship. उन्होंने 4 साल वो रगड़ाई कर रखी है ना, वो बैठ के घिसे हुए हैं, फिर लास्ट में आके बोल दिया कि मैंने तो बस notes पढ़ लिए. It doesn't work like that. What Goga sir is saying is very right. If somebody is saying that I read something superficially and I got selected, is lying, nothing else. All right. So now talking about the structure of the Mission 3.0, we are calling it Batch 2.5. Because sir, you know that, and as students know that in Mission we follow laps. So lap 1 is when we focus on detailed course completion, and we usually want it not to go beyond 90 days. So if we are like 6 months away or 5.5 months away, we would want 3 months plus 1.5 month plus last whatever time is left. So students, lap 1 and what actually it is, how you have to study, I will cover it, is going to be of around 90 days and you have to cover everything in it. Lap 2 is the revision, the first revision. It usually starts 2 to 3 months before the exam. Then we have something called as lap 3 that we do right before the examination. In the mid session, we usually have 2 lap 3s, one for INICT and one for NEET PG. Now let me explain you how it is going to work. So we talked about the things that we need. So for conceptual framework, we are going to use our rapid revision or quick revision videos. We call it quick revision, rapid revision, same thing. For some weaker topics, we may go to mission videos or mission classes recordings. I will explain you what that is. The same thing will get you hold on facts. Our rapid revision videos are neither too long nor too short. I will show you the duration. They are of exact an optimal duration so that you cover majority of the content that is going to come in the exam. We need to have a hold on PYQs. For that we have something called as late night PYQ. MCQ practice subject wise ENDs. If you watch the video of any topper or any ranker from Cerebellum, whether he got ranked under 10 or he got ranked around 5,000, they will definitely be talking about the ENDs. ENDs are the test and discussion in which the teacher comes and does you are asked to take a test and the discussion of that test happens in a live session. There's something called as midday module. What is midday module? Students used to get very confused at how to make custom modules, what to include, what not to include, and the time was also limited. So what we did, we asked all the faculties that go through your Q bank and select certain questions, not too many questions, 200, 300 questions from your subject that you want students to definitely go through. And we created a test of it, which is called as midday module. GTs, we have talked about it. And now we have something new in the app called as Flashcards. I want to talk about flashcards for a minute or two. Flashcard is not a new tool. It is not a separate tool. It's a new tool, it's not a separate tool. All that you are doing throughout the day, the purpose of flashcard is that it goes into your memory by using the tool of active recall, right? So we keep on talking about active recall. Active recall basically makes you remember things for a longer period of time and for a better period of time. And say you are studying pharma. Say you did CNS from pharma. Next day, just do the flashcards of CNS. You would be forced to remember everything that you studied the last day, and it's not 4 options in front of you. You are asked what is the drug of choice for treatment-resistant schizophrenia. Rather than giving you 4 options, I force you to remember what it is, and then the card rotates and you see whether the answer was correct or not. So, flashcard is something new in our preparation, in NEET PG INICT preparation. It was being used in MLE for years and years, and those who use flashcards now would definitely have a bigger advantage because not everybody is going to use it. So early mover advantage would be there. All right. So in Mission 2.5, Mission 3.0 Batch 2.5, one major difference is usually we used to ask students to attend the live classes. Now, while live classes work very well for a large number of students, some students who are interns, students who have lesser time, like who are post-interns with a job, for them live classes is not so much practical. So what we are doing is this time we are keeping certain aspects of mission and adding the rapid revision videos. So in 2.5, we have to cover the first reading in 3 months. So we'll focus on the rapid revision videos of Cerebellum app. So, and we are giving you a structure. So say you are starting from January 13th, auspicious day of January 13th. And of course, you are starting with the auspicious subject of the boss, pharmacology. Now, Goga sir has given 10 hour, 10 minute of content in RR video. Not 4 hour, not 5 hour, 10 hour. And this 10 hour ensures that more than 80% of what is likely to be asked in the exam is covered. Right? So 10 hour, 10 minute, and I am asking you to take 4 days, January 13th, 14th, 15th, 16th. In 4 days, what you will do, you will cover this 10 hour, 10 minute of content. Say on the day 1, you did say general pharma, and say you did autocoids, right? Say another, maybe CVS, something you were able to follow. Now you have to go into the app. You have to go into the test section. I will show you exactly how. In the test section, you have to look for late night PYQs of pharma. For majority of subjects, there are 4 such tests. Pharma late night PYQ 1, PYQ 2, PYQ 3, PYQ 4. And they would correspond to the topics. First 1/4 of the topic covered in PYQ 1. Second 1/4 in PYQ 2. So say in the first day, you did 3.5 hours of video. In the evening, you did the late night PYQ. If you are a post-intern without a job and if you have more time, I would ask you to find the Pharma 1 midday module also. But if you are an intern or post-intern with a job, you can leave it. That is why I have written plus minus here. And then just 20 to 30 minutes of flashcard. So our flashcards are similar to custom module. You go into the flashcard, you choose a subject, you choose a topic and do the flashcard. It is very fun to do it. It feels like a game. Students enjoy doing it and it is going to help you a lot in remembering everything. So in 3 or 4 days, you covered the videos, you completed the 4 late night PYQ tests, you did or did not do midday module, you did flashcard. On the 4th day, after covering everything, you would again go to the app, test section, subject test, and you would take the END of Pharma. It will have 75 or 100 question. Take the test, do the video that is attached to it in which the sir would be discussing it, and your first subject is done. In 4 subject we complete, in 4 days we complete Pharma. Then you go to pathology. Same thing, you do rapid revision videos in 4 days, you do the late night PYQs of pathology, you do the midday module flashcard, pathology END, and finish. You go to the next subject. I have kept few catch-up days. Say because of some reason you were not able to complete something, you can use it in the catch-up day. So sir, this is the main format. Content with rapid revision video, more than 80% would be covered. Whatever is left would get covered in the END. Late night PYQ will ensure a high grip on PYQs, and so flashcards would ensure that the memory keeps on getting better. Students, when you do flashcard, another great thing happens. The flashcards, we are following a SM2 space repetition algorithm. What you did today would come tomorrow in your app. It would again come 4 days later, then 7 days later. And if you're making a mistake in a card, it would come more frequently. So say you have reached Jan 23rd. If you open your app, the flashcard would show you content from both, from pharma also, patho also, psychiatry also. Students, sir, have this complaint कि sir जो 2 महीने पहले पढ़ा था वो कैसे रिवाइज करूं? Now we have a way of revising it, and you don't have to go through the bulky notes or videos. Crisp, short content, bit-sized flashcards keeps the information fresh in your brain.
So basically, we have solved your problem of what to study, how much to study, when to study. So that is the main problem. Every student I know want to study, yeah, but they have no idea how to complete a syllabus, when to study what, and exactly what to study so that they can cover most of the things.
Right.
So this will be solved by this schedule.
So what sir was talking about structure, this is a structure, this is a schedule. So then we go to anatomy, 8-hour videos, anesthesia, very less, around 2 hour, ortho, just 3 hour, surgery. Now this is something that we want to talk about. Surgery, sir, students have complained ki kaise ratta mare, how to remember. Dr. Amrit Nasta has done a phenomenal job of making surgery conceptual. And ask any friend of yours who has done his classes or done his videos. It's an open challenge. Ask any of your friend and you will find him or her being very impressed with him. He has done a phenomenal job with surgery. 29 hours of content, but you know the amount of questions that come from surgery, and it's sorted. Similarly, for ophtha physio, medicine, I am not asking you to do the quick revision video. Quick revision or rapid revision videos around 45 hours. Why am I not asking? Because sir has created something called as medicine in a day, which is just 24 hours of content, and it had more than 90% strike rate in NEET PG 2025. Sir, around 60 questions came from medicine, as many as 60 questions, and I think from medicine in a day, 54 or 55 questions were covered. So those 24 hours are gold. See, if you are sorted with medicine and surgery, imagine how much of it is sorted. Amazingly good videos, amazingly high yield content, and unbelievable strike rate. Biochem, you would love studying from Dr. Ankur, ENT, forensic medicine, PSM, of course, Vivek sir, OBG, dermat and pediatrics. With all of this, you complete your first reading by March 9th. What after that? So after that, we have our lab 2. Goga sir, what exactly is lab 2?
So lab 2 is basically a revision of what you have studied in lab 1. So it will be, in lab 2, there will be live classes.
Right.
And you will be revising with the teacher.
Right.
So you have already done lab 1. You know the main contents. Now the teacher will quickly revise them. So you will attend the 4-5 hour lectures and then you will revise yourself. So that will become 2 revisions. One by lab 1, then lab 2, one from the teacher, and second when you study. So they will become 2 revisions. So you can do live classes, or if you do not get time to do live classes, you can continue with your rapid revision videos, but there would be live ENDs also in the lab 2. We would advise you to at least follow the ENDs. Because when you have a test in the app, the chances of you completing it and sitting and listening to the teacher becomes better.
So this is your lab 2, and other things would continue like late night PYQs and all of that will continue. So this is how your day should look like in Mission 3.0 Batch 2.5. You watch rapid revision videos and you have quick revision notes. So the notes which correspond to rapid revision videos are quick revision notes. Let me write it down. And you keep on underlining or annotating, and this would become your go-to notes finally. You complete the late night PYQ session along with the subject. You do at least 2 custom decks of flashcard. It would hardly take you 20 to 30 minutes. And once the videos are complete, you do the subject-wise test and discussion. All right, Goga sir, now let's take some important questions. How to cover MCQs quickly? Students keep on asking that, sir, I am doing late night PYQs, I am doing midday modules, but it is taking a lot of time to revise. Even that has been taken care of. If you look at the question bank of Cerebellum or PYQs of Cerebellum, we have added something called as educational objective to the questions. So you did one question. If you knew the answer, you can quickly go through it. And if you are not getting enough time, educational objective tells you the crux of the question, what exactly is being asked in 1 or 2 lines.
Basically, what is there after every MCQ, there is explanation. Explanation is a little longer. It is explaining all the 4 options apart from the answer also, every detail. And then there is educational objective. Educational objective, the main purpose is when you have lesser time. Like you want to solve 100 questions and you have only 2 hours. So what you will do is you will just read the educational objective that will cover all the important points related to that question.
Right. So it helps you to cover the MCQs very quickly. Extra information, either you can add to the quick revision notes, or you can make this 20th notebook or 20th book or choti copy, whatever you want to call it. A lot of students call it different names. A copy in which the mistakes that you are making, just keep on writing those mistakes subject-wise, right? I told you about this. If you develop backlog, that is fine. Continue with the schedule. In between, whenever you get extra time, there's a catch-up day or something, use it to complete your backlogs. We told you that we will help you do revisions. After lab 1 will come lab 2, after lab 2 will come lab 3, and after necessity another lab. So there would be multiple revisions. So revisions are sorted out. We have talked about flashcards already. Goga sir, how often GTs must be taken?
GTs at the start of your preparation, it must be given within 10 to 14 days. But after 1 or 1.5 month of your preparation, now it has to be given once in a week.
Right. So to start with 2 in a month and then maybe 3 or 4 in a month. We have talked about this. The answer is a resounding yes. Even if you're starting your preparation today, we have enough time. And guys, some of you might have watched my videos where I talk about my story, how I cracked the exam in 40 days. If it can be cracked in 40 days, it can be cracked in 3 months or 4 months. And forget me. You must know about your seniors who passed the exam, who cracked the exam in 3 months, 2 months, 4.5 months. It is all about studying, accelerating, reaching the peak of your momentum in the end, and just vomiting out the information. Medical exam would always be very high on factual information, and you know that none of us can remember it all. So in the end, if you are able to densely remember things, your results become better. So I just added some slides. So about the late night PYQ and the midday modules, in the app, you go to the test section and you will find this midday module late night PYQ marathon. You went to late night PYQ marathon, you will find topic wise late night PYQs like this: 1, 2, 3, 4, 5. In pharma, there are 4. In anatomy, there are 5. For majority of subject, there are 3 to 5. Right? So this is how you do these PYQs. This is how you do the flashcard. Say you have done anatomy. You go to the custom deck part of the flashcard. You choose 50 cards, and whatever topics that you have read, you can choose them and you will get the flashcard from those topics. And then the revision flashcards keep coming here in today's deck. See, due cards. This is what it shows. In the subject test thing that I told about, again go to the test section of the app, look at subject test CND, look at the subject and the top one just appear for this test. If you have more time, do more tests, but this is the one which is the most important. So students, this is the plan, batch 2.5. You start with rapid revision videos, later on you go to lab 2, lab 3, right? And you do the questions using the different tools that we have talked about. You improve your memory by using flashcards, and you maintain the structure and discipline. Sir, you want to say?
I think we have missed telling about lab 3.
lab 3, okay.
So after lab 2, which will last for around 2 months, so there will be marathon session which is called as lab 3. So first there will be lab 3 for INICT. So INICT marathon. So in 1 week we will cover all the subjects live. So you just need to sit and listen. So that will be revision for you. So within 7 days you can revise all the 19 subjects from the respective teachers.
And in case you are not able to attend live class, you can either watch the recorded videos of the last session or the current session.
Yes, definitely. So after INICT, before the NEET, because we do not know how much time is there. So whatever time is there, we will make a schedule for that also, and we will give one more revision during that time.
Right. So that's sort the revision part. So it's a very high, it's a very structured program, very thought of program, and if you just follow it, things will start happening. So for those of you who are not a student of Cerebellum, you can go to the cerebellumacademy.com website or the app and just look for Mission 3.0 with quick revision notes, right? I think 6 months is some 25,000, 1 year is some 35,000. I'm not sure about the charges. It is something like this only. And if you use the coupon code of Cerebellum, you'll get some discount as well. So students, start this. It's not late, and a lot of things would be done. If you just follow what is being told to you, believe you me, you can get any rank. Whether you are aiming for rank under 500, under 1000, under 5000, whatever your aim is, we still have enough time, and if we study hard, we'll definitely get it.
So my last word will be just stop asking that can I do even if I start now? The answer is a big yes. So only important thing is you have to consistently work hard for next 6 months. Like if you do so, definitely you will get a good score.
And last point, if you have these thoughts that kafi hoga ke nahi hoga, is it enough or not? Please don't go into FOMO. If you do this, I promise you, you will get a good rank. Right? Main videos kar payenge, ye kar payenge, wo notes, ye offline classes, ye choti classes. Forget about everything. Do this, you are sorted. All the best.
All the best.